question on that. So let's move on to our next speaker, Claire Currie. Claire works for PCC and is a consultant in public health. Claire and I have worked on many panels to do with various aspects of health. So Claire, you're coming on to speak about myth busting and where to find proper information. Claire.
Thank you ever so much, Lord Mayor. I'm just going to share my screen if I can. Hold on. Sorry for the delay. Here we go. Is that working?
It's starting. It's saying you've started. Then, yep. Now we've got your PowerPoint up.
Fantastic, brilliant. So I'll put on the slideshow. There we go, excellent. So firstly, I just want to say thank you ever so much for having me to speak today. It really is a huge honour to speak to you, and I'm really excited about the opportunity, because for me, working in public health, this is really, really important. And I don't quite know how I'm going to follow Dr. Safs's inspirational talk there. So thank you very much for all your brilliant words. But let's hope that I can answer some questions. I'm really looking forward to answering some questions as well. So firstly, just a few key messages really. So vaccines do indeed save lives. As we know, we have a whole vaccination programme in the country, which helps us manage a whole range of diseases, and vaccines are one of the most, if not the most, effective intervention that we have in terms of preventing illnesses around the world, and that absolutely is the case here. So this vaccine is no different. It is our way out of this pandemic, not straight away, but it absolutely is on the path towards that. So the only way to be protected against COVID is to have the vaccination, and a really key point is really that they have been assessed as safe and effective really thoroughly and very rigorously, and I'm going to come on to talk more about that. So the vaccines that are in use have been shown to be effective at preventing the most serious disease, illness from COVID, hospital admissions, and unfortunately death as well. After vaccination, really important that it's not the end in itself, and we do need to continue to be mindful and strictly adhere to all the messages and things that we've been practicing now for a long time, for almost the last year really, around hand washing, wearing face coverings, keeping to social distancing, and also all the other restrictions that are currently in place as well. So why are we talking about this, and why particularly do we want to talk about this issue really honestly and openly with Black and minority ethnic groups? Well, we know that from other vaccination programmes, seasonal flu is a really good example, that there is lower uptake in different groups in the population, and that is the case in some Black and minority ethnic groups. For the COVID vaccination programme particularly, there's been various surveys really in the country to try and understand what vaccine intention or intention to have the vaccine looks like. And overall it's incredibly positive, and that's really, really encouraging, because one thing is to have effective vaccines, but we also need to make sure that high uptake is also needed. It's the combination of those two things which is really going to help us. So in terms of what some of the recent survey data has shown, overall there's high willingness to have vaccines, but there are marked differences. So particularly Black ethnic groups have been shown to perhaps have higher hesitancy towards vaccination, and as well as some Pakistani and Bangladeshi groups. There's also been some hesitancy noticed among Eastern European communities too. So it isn't at all a sort of one size fits all. But it's very much, we need to have a quite a nuanced understanding in order to try and make sure that we provide useful information that's going to really help. So picking up on a question that I think has also been asked in the chat, but in terms of, that's the national picture I've just described, but what do we know locally? So Portsmouth City Council did a survey of local residents to try and understand a bit about local intention to have vaccination, local attitudes towards vaccination, and again really very closely mirrors the sort of national picture. So as you can see at the top left bar on the screen, about 80% of local residents who responded to the survey thought they would be likely to have the vaccine, which is fantastic. You'll see there's differences by age, so older adults more likely to have the vaccine, and that's really not a great surprise because it is older age groups who experience more severe illness and therefore are perhaps more fearful of catching COVID, and therefore are minded to have the vaccination to a greater extent. You'll also, however, notice the stark difference between what's grouped just in two groups here, the white group, and then about 20% lower Black and minority ethnic groups having a much sort of lower intention to have the vaccine. So that's clearly really important for the city to make sure that the offer of vaccination is accessible and appropriate to everyone. So this is just why this is so difficult, really. So someone might have an intention to have the vaccine, but actually going to get the vaccine is what we're aiming to, and that can be influenced by a whole range of factors. And it isn't about saying that everyone has the same view of this. This is very much, I put the person in the middle there because this is very much remembering that every person is an individual and there's lots of different influences on every one of us. So that whether that relates to views of our friends and families, whether that relates to our cultural or religious backgrounds and beliefs, whether that relates to how the programme is designed in terms of which groups are called forwards and how, where the vaccination sites are. There's a whole range of factors. It is a complex picture, but hopefully this type of information sharing is helpful. So just picking up on what Dr. Safdar was saying about how to take up the offer of vaccination, really the message is, wait to be called forward by your GP to book an appointment. It is nationally led and there are the nationally defining groups, so not everyone is being called forward at once, but it is being rolled out, the programme. There are a variety of sites in Portsmouth to offer the vaccinations from GPs, exactly as Dr. Safdar has said. There are a couple of community pharmacies. There's also St James's Hospital, which is the large vaccination centre. There are also vaccinations happening at Queen Alexandra Hospital, and they're mainly for the sort of staff and healthcare staff working in various settings. So that's not a sort of a public booking route, if you like. But the intention of having the range of sites is to really enable access and to hopefully make sure that there's a way of accessing vaccination which is one, local, and two, amenable to everyone. So in terms of the national priority groups, I've just listed them here. I'm not going to go through them in detail, but the ones highlighted in bold down to groups 1 to 4, I just want to sort of highlight that's where the vaccination programme has currently sort of rolled out to. So those are the groups currently being invited for vaccination, and the groups beyond that will come online in the coming sort of weeks and months. You'll note there are age groups there, as well as clinical risk groups, and that covers a broad range of clinical risk groups, and that's what your GPs will be looking at in terms of calling you forward. So just in terms of how some of the common kind of or bits of misinformation or myths perhaps around and concerns around the vaccines. Just going to touch on some of those now. So one of the main concerns is how quickly the vaccines have been produced, and I can completely understand where that concern comes from, because it is really quite remarkable that in the space of a year we're at the stage in a global pandemic where vaccines which have been assessed as safe and effective are being offered to all of us. So really the main messages here is no corners have been cut, and actually the vaccination development that we've seen in recent months has really built on a huge amount of research that's gone into coronavirus vaccines before this pandemic, plus now lots of collaboration, funding, which has enabled all of that to really come to fruition at pandemic speed, as I've put here. And that following the development of the vaccines, obviously it's the Medicines Healthcare and Regulatory Agency, which is a national agency which assesses all of our medicines in terms of their safety and effectiveness, who have really looked at these very closely, all the data for the vaccines, and said that they are safe and effective. I won't show this little video now, but it's from the Wellcome Trust, and I'll put it in the, these slides will probably be shared if people want them. And it's a really good little video, just a minute long, and I can show it later if there is time, just really showing you know, how it's been possible to develop these vaccines so quickly, rather than having each phase of the trials and each stage of vaccine development one after the other, which is what usually happens. It's actually been possible to run some of those phases alongside each other, which has compressed the timeline for vaccine development. But I can come back to watch that video if there's a bit of time at the end. Another common concern that people may have is that I can catch COVID from having the vaccine. Now, this again isn't true at all, so it's not a concern to be worried about. It's not that there's two different vaccines which are currently being used. They do work in slightly different ways, both of which are safe and effective, but they're not using the live COVID virus, and it's not possible to get COVID from them, and that is very much evidence-based. One thing to note, it is possible, obviously, to get COVID just before you have the vaccination, or indeed just after you have the vaccination and before the body's had a chance to build that immune response. And so for some people, it might seem that they've had the vaccination but they've got COVID, but there is that small period of time, 10 days or so, where the body is building immune response, and so if you get COVID in that time, it's not because of the vaccine, if that makes sense. One common concern across, you know, a big concern across the population really, is that vaccines affect fertility. So this, sorry, I put that bit twice there, but no. So there's no evidence that vaccines affect fertility at all. I think this started from some misinformation shared on social media, and I think it sort of, you know, really did get shared quite widely, and you know, that's a very sort of typical example of how a message can get picked up and sort of run with, whereas actually there's no evidence that that actually is the case. So women of childbearing age have been included in trials where these vaccines were tried in, and that hasn't led to any concerns around fertility at all. And the concern that was sort of raised was very much a theoretical concern and hasn't been shown at all to have any sort of to be, you know, plausible in how the vaccine actually works. That is a position which is backed up and endorsed by the Royal College of Obstetricians and Gynecologists, so from the medical body, who specialise in those issues, and so that is that isn't true as a statement. Another common concern is I can't have the vaccine because I've got allergies, and that's something which Dr. Safta has already picked up. So it's the case that there are actually very few people who can't have either one of the vaccines. There is, you know, some reports of anaphylaxis, as Dr. Safta has mentioned, with the Pfizer vaccine. Very, very rare, only excludes a very small number of people, and actually it might be possible to have the other vaccine if that one isn't the case. So there are very limited reasons why people can't have these vaccines. So just coming on to what to expect after vaccine, as I've started out with really. So in order to protect yourself, other residents in Portsmouth, your family, your friends, your colleagues, you know, all the current measures still remain really important. So practicing social distancing, wearing a face covering, washing your hands, and also following other restrictions. So no vaccine is completely effective. These are safe and effective vaccines, but they you know, no vaccine is going to protect absolutely everyone. They are effective at preventing serious illness, so that's really important. But what we don't know, and there are some things we don't know about these vaccines, we don't know how they may or may not help in how people pass the vaccine from one person to the other. And it's that chain of transmission from one person to the next, even if someone doesn't become unwell, that is really, really still important, because it's that chain of transmission which can lead to someone who isn't protected from the vaccine or is in a vulnerable group perhaps, who may then become unwell and may become seriously unwell. So we still need to practice all these other measures currently until such a time where vaccination enables us to get back to a point of more towards normality. So just one other thing I'd like just to highlight is around scam awareness, unfortunately. So there have been reports around the coronavirus vaccine and also actually around testing for coronavirus, but I want to just particularly pick up on here around vaccinations of people asking people being asked to book an appointment, and either that page sort of taking them to another page to ask for bank details or various instances like that. So there are ways of reporting these scams, which are really, really important. And really, it's really, really important to note that the vaccine is free. So you should never be asked to enter any bank details or pay for anything. This is all free, and the offer of vaccination should be accessible and as accessible as possible to everyone in Portsmouth and indeed across the country. So I'll come back there to my key messages that I started out with, and I'm really happy to try and answer questions that you may have.
Thank you, Claire. One question I can see that somebody's asked with that, because the rest I think we'll save for the panel, that somebody was asking first of all about ensuring health information is being shared, etc., and delivered effectively, and also about whether any work had been done on the BME community, and you've obviously said there is. They've asked when that would have been gathered.
So the resident survey was done in December, and it was a period of time in December. So it would have been sort of at the sort of very beginning of when vaccines were starting to be made available. So it's sort of clearly vaccine intention can change over time. So if people perhaps don't think there's a prospect of having the vaccine, that may alter their view. So it's actually quite a useful snapshot, because it was at a time when the prospect of having a vaccination was a kind of real possibility.
Okay. I'm going to move on to the next one. We're just slightly running out, and I just want to make sure we've got enough questions for the panel afterwards.
Thank you ever so much, and thank you to our speakers this evening, and thank you to all of you for giving up your time tonight. I'd like to talk a little bit about the support that's available for the community in Portsmouth during this time of pandemic and lockdown. And as well as services from public health and the City Council, there are many community groups and charities that offer help for families and individuals who are in need. Many of us have struggled with having to stay at home or with money worries at this time. And we want to encourage you to get to know any local groups that can help you. So Hive Portsmouth has a directory of services on their website, including public health and city council services, but also community groups and charities. And if you are a community leader and your group is not included, please get in touch and we can add you to the wonderful list of organisations offering support, not just now, but throughout the year. I am going to very quickly share a slide which will let you know all of our contact details. Let's do that properly. So these are our contact details. This is our website. We also have the Hive helpline, and this is for anybody who wishes to ring to find out if they've got any concerns about money worries or anything like this. And again, anybody can ring this to get support. We have social media links, and this at the bottom is our website as well. But we will be sharing all of this information. So So Portsmouth is such a vibrant and diverse city, and we'd like now to show a short film produced by Sumel Chowdhury, showcasing local leaders talking about the vaccine, and then it's back to the Lord Mayor for the next part of the evening. So if you could bear with me while I just share this and share sound.
Hello. This past year has been extremely challenging for all of us here in the UK and across the world. We have suffered in many ways, from restrictions on our daily lives to losing our loved ones.
But we will find our way through this, and we will be united again with our friends and families. All we have to do is to take the vaccination.
We wanted to come together to tell you that we know many of you in our community are worried about taking the vaccine, but it's completely safe.
We know there are many fake news stories and messages around the vaccine, so we wanted to clear some of them up.
There is no evidence it affects those from ethnic minority group differently from those who are not.
The rapid production of the vaccines against the coronavirus was only possible due to the global effort of governments around the world investing heavily into the research and development of these vaccines. These vaccines normally take years to develop, but this was developed in months.
There are no cases of significant side effects, and the vaccine has gone through the same processes and regulations as the other vaccines you have already had. From personal experience, I had the vaccine a few weeks ago, and the only thing I suffered from was mild body ache and fatigue, which lasted for a day.
These are just a few of the myths surrounding the vaccine. And if you have had any others, please do not hesitate to contact your GP or a doctor.
Looking after each other and serving our community is what we do. It's how we've been brought up, and it embodies our values.
Just one simple step will mean we can all eat, pray, meet, and hug together again. Not only will you be saving your life, you'll be saving many other lives. And again, there is no better gift than that.
Take the vaccine. I had mine and I'm absolutely fine.
Please don't let misinformation put you and your loved ones at risk. Let's work together, get the vaccination, and end this virus once and for all.